Hi, my name is Yslene Otacoma and I'm going to talk about hepatocellular carcinoma. Definition. Hepatocellular carcinoma is the fourth most common primary liver malignancy. Risk factors for HCC included chronic hepatitis B and hepatitis C, alcohol addiction, metabolic liver disease, and exposure to dietary toxins, such as aflatoxins and ursolic acid, with a higher incidence in Eastern and Southern Asia, Middle and Western Africa, Melanesia and Micronesia or Polynesia.
Most importantly, though, things that put the liver in a constant cycle of damage and repair are the biggest culprits. If the liver cells are constantly being forced to repair, this raises the chances of genetic mistakes or mutations, which potentially leads to carcinogenesis or development of cancer cells. Examples might be any disease that leads to cirrhosis and scarring of the liver tissue, which can include alcoholic hepatitis, hereditary hemochromatosis, primary biliary cirrhosis, alpha-1 antitrypsin deficiency, and others. The most common risk factor, the one that's been linked the most with hepatocellular carcinoma, are the hepatitis B and hepatitis C viruses, both of which can become chronic and long-lasting. In this case, the cells are at greater risk because of the constant state of infection and immune cell attack, which leads to this constant damage and repair. HBV is particularly problematic because of how the virus replicates. The HBV virus is a DNA virus that integrates into the hepatocyte's DNA, which, although not completely understood, is thought to either directly disrupt regulation of cell growth and replication, which leads to carcinoma, or cause some indirect effect that later leads to unchecked cell growth and replication. One interesting risk factor, though, is exposure to aflatoxins. Aflatoxins are highly toxic chemicals produced by certain Aspergillus molds that can be found in certain foods when they start to decay, like grains, peanuts, and vegetables. As foods that have this type of mold are eaten, aflatoxins are also eaten, and then they're absorbed in the small intestine and sent to the liver for metabolizing. The most potent type of aflatoxin thought to be involved in carcinogenesis is aflatoxin B1, and when it gets to the liver, it's metabolized to aflatoxin B1,8,9 epoxide. And now this guy can bind right to DNA, called a DNA adduct. And this interaction leads to mutations in the p53 tumor suppressor gene, which usually, when it's functioning right, stops the formation of tumors. So if it becomes mutated and dysfunctional, tumor formation and carcinogenesis might follow. Now, because most patients with hepatocellular carcinoma also have cirrhosis, the hepatocellular carcinoma can be hard to spot. Symptoms of long-standing liver disease like cirrhosis often masks the progression of carcinoma, and often patients have no symptoms directly related to the tumor itself. A delay in detection of any disease typically means a worse prognosis, right? And hepatocellular carcinoma is no exception. In general, the cancer might be focal or limited to one area, but it might also have several areas affected and be multifocal, or it could even spread diffusely through the liver tissue and not really have any distinct focal points at all. A classic sign of a secondary hepatic tumor, though, are multiple focal points that can even be sometimes felt on the free edge of the liver.
Applications in medicine. Early stage HCC can be treated curably by local ablation, surgical resection, or liver transplantation. Catheter based local regional treatment is used in patients with intermediate stage cancer. Kinase and immune checkpoint inhibitors have been shown to be effective treatment options in patients with advanced stage HCC. Pros and cons. Pros. All risk factors are potentially preventable. HCC surveillance and early detection increase the chance of potentially curative treatment, achieving a substantial reduction in the worldwide HCC burden within the next few decades is more probably. Cons is the fourth cause of cancer-related death worldwide. The age suggested incidence of liver cancer has risen from 1.6 per 100,000 individuals to 4.6 per 100,000 individuals among American Indians and Alaskan Natives. HCC surveillance is substantially under-realized.
Today is hepatologist and assistant professor of internal medicine, Dr. Lanla Conte. Lanla, welcome to the program.
Thank you, Jim.
Well, Lanla, why is the incidence of hepatocellular carcinoma so high throughout the world, and why is it increasing in the U.S.?
Absolutely. So even though HCC, hepatocellular carcinoma, is very common in the United States, it's actually more common in parts of Asia and sub-Saharan Africa. And the reason for that is because of hepatitis B. Most of those places don't have access to hepatitis B vaccination. And in the United States, a big reason why it's increasing is because of fatty liver disease. We know NAFLD, non-alcoholic fatty liver disease, is increasing, and with that comes cirrhosis, which also brings HCC.
Well, 20 years ago, other than surgery, there was really nothing that could be done for patients with hepatocellular carcinoma. How has the treatment portfolio changed?
Absolutely. We have come a long way in the past 20 years. So now when a patient presents to clinic with a new diagnosis of HCC, we can walk them through all the methods of local regional therapy that we have available. And today we will be talking about some of those methods of local regional therapy for HCC management.
Well, thanks, Lanla.
Thanks.
Before we get started, let me remind you that you can send us your questions about hepatocellular carcinoma by clicking on the email icon at the bottom of this webpage. And now let's get started with today's program. Lanla?
Issue pleaded in Ecuador. In Ecuador, a study carried out on 106 participants with a diagnosis of hepatocellular carcinoma who attended the gastroenterology service of the Solca Oncological Hospital during the period 2012 to 2016. It is evident that the mean age of presentation of hepatocellular carcinoma is 65 years, being more common in the male sex. Conclusion: HCC is cancer-related disease in many regions of the world, particularly in African and Asian countries, where medical and social care resources are often limited. HCC surveillance leads to early detection of cancer and improves overall survival. It's necessary the implementation of programs for viral hepatitis screening, HCC surveillance in high-risk patients, and effective treatment of HCC to improve the current dismal outcomes of patients with this disease. Thank